Here's something most people don't realize until it's too late. There's a 7-month window around your 65th birthday that determines your healthcare costs for the rest of your life. Miss it, and you could be looking at permanent penalties added to your bill every single month, forever. If you turned 65 last month, you might think that window is closing or already closed. Stick around, because I'm about to show you exactly where you stand and the steps you need to take right now to avoid a costly mistake. My name is Chen, and I've been a licensed Medicare advisor for 15 years. In that time, I've seen thousands of people in exactly your situation. And here's what I've learned. Most of them think they've made an irreversible mistake, but the truth is far more hopeful than that. If you turned 65 recently and haven't enrolled in Medicare yet, you still have options. Real, legitimate options. And in this video, I'm going to walk you through every single one of them step by step, so you know exactly what to do, what it will cost, and how to minimize the damage if you miss the enrollment window. Before we dive in, if you found this helpful, please hit like, subscribe, and turn on notifications. This channel is designed for people in exactly your situation, people who are navigating Medicare later than they planned, and who need clear answers, not confusion. I'll be uploading videos about Medicare enrollment, penalty appeals, and late enrollment options every single week. Your situation is more common than you think, and you're not alone. Now, let's get into this. Medicare has something called an initial enrollment period, or IEP. It's not a single day, it's a 7-month window, and it works like this. Your initial enrollment period starts 3 months before the month you turn 65, and it ends 3 months after the month you turn 65. That's 7 months total. Let me give you an example. If you turned 65 in June, your initial enrollment period started in March and ends in September. That's March, April, May, June, July, August, September. 7 months. But here's the part that shocks people. Most people assume they can enroll in Medicare anytime after they turn 65. They think, oh, I'll get around to it next month. But Medicare doesn't work that way. There's a window, and if you miss most of that window, there are permanent consequences. I had a patient, Robert, who turned 65 in April. He was still working. His employer had health insurance. He thought, I'm covered through my job. I don't need Medicare right now. I'll enroll when I retire. Sounds logical, right? But what Robert didn't know was that by waiting, he was setting himself up for penalties that would follow him forever. When you don't enroll in Medicare Part B during your initial enrollment period, Medicare charges you a late enrollment penalty. And not a small one. Part B covers doctor visits, outpatient services, and preventive care. If you don't enroll when you're supposed to, you pay a penalty of 10% of the standard Part B premium for each 12-month period you were eligible but didn't enroll. But here's the brutal part. That penalty is permanent. You don't pay it for a year and then it goes away. You pay it for the rest of your life. In 2024, the standard Part B premium is $164.90 a month. 10% of that is $16.49. That doesn't sound like much. But Robert? He delayed enrollment by almost 2 years. That's 2 12-month periods. So his penalty became 20% of the standard premium. That's about $33 per month, added to his Part B bill, permanently. Over a 20-year retirement, that's $7,910 in extra money he'll never get back, all because he waited too long to enroll. And that's not including the penalties for Part D prescription drug coverage, which work the same way. I had another patient, Margaret, who turned 65 while she was still working overseas. She thought she had a valid excuse. I was traveling. I didn't enroll. But surely Medicare will understand. Medicare doesn't care about excuses. She didn't enroll in Part B during her window. That's a penalty, permanent, on her monthly bill. If you turned 65 last month, you're not necessarily in permanent trouble. The situation depends on one critical detail. How many months have passed since you turned 65, and whether you've already enrolled or not. If you're reading this, and it's been less than 3 months since your 65th birthday, your initial enrollment period is still open. You still have time. You're not late. You're not facing penalties. You just need to act immediately. If it's been more than 3 months but less than 7 months since you turned 65, you're in a gray area. Your initial enrollment period is closing, or recently closed. You might be facing penalties, or you might not, depending on specific circumstances. But there are pathways. There are still options, and if your initial enrollment period is completely closed, if it's been more than 7 months and you haven't enrolled, there are still solutions. They're not as clean as enrolling during your window, but they exist. And I'm going to walk you through all 3 scenarios. What you need to do immediately is enroll in Medicare Part A and Part B. This is non-negotiable. Here's the process. Go to medicare.gov or call 1-800-MEDICARE. Tell them you're turning 65 or have just turned 65, and you want to enroll in Medicare Part A and Part B. You can do this online in 10 minutes. You'll need your Social Security number, birth date, and citizenship information. Part A covers hospital stays, skilled nursing, hospice, and home health. Part B covers doctor visits and outpatient care. Here's the thing. If you already have Medicare Part A, and many people do automatically if they're receiving Social Security benefits, you just need to enroll in Part B. Once you enroll in Part B during your initial enrollment period, no penalty. Your Part B premium is standard. No extra charges for the rest of your life. You'll also want to enroll in Part D, prescription drug coverage, during this window. Part D has the same penalty structure as Part B. If you don't enroll when you're supposed to, and you don't have creditable coverage from somewhere else, you'll pay a penalty. It's based on how long you go without it. Roughly 1% of the national average Part D premium for each month you didn't have coverage. I had a patient, James, who called me 3 weeks after turning 65. He'd procrastinated. He was stressed about the forms. He thought it was more complicated than it was. We sat down, walked through Medicare.gov together, and he enrolled in about 12 minutes. Part A, Part B, and Part D all locked in. No penalties, no extra costs. His only regret? That he didn't call sooner and stop worrying. If you're in this situation, take this as your sign. Make the call today. Do it right now. Call 1-800-MEDICARE. Spend 10 minutes on the phone. Get enrolled. That's it. Crisis averted. If your IEP just closed, you might face what's called a general enrollment period. But this comes with penalties. If you enroll after your IEP ends, you automatically owe a late enrollment penalty. However, there's a potential lifeline called a special enrollment period, or SEP. A special enrollment period is a time outside your regular enrollment window when Medicare lets you enroll without penalty. But it only applies to specific situations. You don't qualify for a SEP just because you procrastinated. You qualify for a SEP if 1. You were covered by employer health insurance because you or a spouse was still working. If that coverage ended, you have a SEP to enroll in Medicare without penalty. 2. You had creditable prescription drug coverage at least as good as Medicare Part D. If that coverage ended, you have a SEP. 3. You moved to a different state and your current Medicare plan isn't available there. 4. Your plan leaves the Medicare program. 5. You become eligible for Extra Help, the low-income subsidy program. There are a few more, but these are the most common. Here's the beautiful part. If you qualify for a SEP because your employer coverage ended, for example, you can retroactively enroll in Medicare without paying a penalty. You enroll now, but Medicare credits your enrollment back to the month your employer coverage ended. I had a patient, Dorothy, who turned 65 while still working. She was covered by her employer. She thought, my health insurance is taken care of. I don't need Medicare right now. Then she retired. Her employer coverage ended. She called me in a panic thinking she'd be hit with permanent penalties. But we looked at the details. Her employer coverage ended in November. She called me in January. Because her employer coverage ended, she qualified for a special enrollment period. We filed her Medicare application with documentation showing when her employer coverage ended. Medicare enrolled her retroactively to November, the month her coverage ended. No penalties. She was protected. If you think you might qualify for a special enrollment period, call Medicare immediately. Don't wait. Don't assume you'll owe penalties. Call. Explain your situation. A representative can tell you in minutes whether you qualify. But it's not hopeless. You have 2 options. Option 1, you enroll during the general enrollment period, which happens every year from January 1 to March 31. Your coverage then starts July 1. But, and this is important, you'll owe a late enrollment penalty. The Part B late enrollment penalty is 10% of the standard premium for each 12-month period you went without it. If you've been without Medicare for 18 months, that's a permanent 15% increase to your Part B premium for the rest of your life. That's roughly $25 extra per month, permanently. on top of the standard premium. Option 2 is much better, and most people don't know about it. You can file what's called a Part B enrollment exception request, or appeal. Here's how this works. If you can show that you had good cause for not enrolling during your initial enrollment period, and good cause is broad, you can appeal the penalty. Good cause includes things like you didn't receive the notification about Medicare deadlines, you were confused about whether you needed to enroll, you had a serious medical condition that prevented you from applying, you were experiencing a hardship, you were given incorrect information by Social Security or another official source. This is where many people in your situation actually have a real shot. I had a patient, Michael, who turned 65 during COVID. The Social Security office was closed. He couldn't go in person. He tried calling but couldn't get through. He didn't enroll during his window. When he finally applied 8 months later, he thought he was facing permanent penalties. But we filed an appeal. We showed that during his enrollment period, the Social Security office was closed due to COVID. We included documentation. We showed that he tried to reach them, but couldn't. Medicare reviewed the appeal and said, "You know what? That's good cause." They waived the penalty. Michael enrolled without paying any late enrollment penalty. He was protected. All because he appealed. Here's what I want you to do right now, depending on where you are in this timeline. If you turned 65 in the last 3 months, do not wait. Call 1-800-Medicare today. You have no penalty risk. You just need to act before your window closes. Enroll in Part A, Part B, and Part D. Do it today. If you turned 65 between 4-7 months ago, call 1-800-Medicare or visit Medicare.gov. Verify exactly when your initial enrollment period ends. If it hasn't ended yet, enroll immediately. If it just ended, ask about special enrollment periods. You might qualify. If your enrollment period is completely closed, Step 1. Determine if you qualify for a special enrollment period. Call 1-800-Medicare and explain your situation honestly. Don't assume you don't qualify. Let them tell you. Step 2. If you don't qualify for a SEP, file a Part B enrollment exception request. Medicare has a form for this. It's called the Application for Enrollment in Part B, CMS 40B. Call 1-800-Medicare, request the form, fill it out, include documentation of your circumstances, and submit it. You're not asking for special treatment. You're asking Medicare to review whether you had good cause for your late enrollment. Many appeals are successful. You won't know if yours qualifies until you try. Step 3. If your appeal is denied, you still enroll during the next general enrollment period, January-March, but you'll owe the penalty. However, that penalty can sometimes be appealed later if circumstances change. You're not locked in forever.